Okay. Hi, everybody. I'm Dimitris Spachos, currently a PG student on medical school. I work, among others, in Millenium Hospital project. This session is about this project. I'm going to introduce you to the project for 2 or 3 minutes, and then my colleague, Dr. Panagiotis Antoniou, will guide you through a e-learning environment. So, about the project. The Millenium project develops innovative blended training solutions built on modules, competencies, and learning outcomes which embed the serious game experience-based and learner-centered methodology in the field of Italian continuing medical education, in the field of minimal invasive surgery. Millenium project will adapt to the needs of Italian continuing medical education in the specific fields. Quality standards and solutions developing 2 e-health European best practices and European Union shared quality criteria and e-learning resources in continuing medical education. We'll do that by integrating 3 contributions. The first is the project Mirror. It's an ICT-based learning methodologies, a set of ICT-based learning methodologies and innovative serious games solutions. You're going to see it in a while. The second is the project Educator. Is a set of standards for high quality and full accessible learning resources for continuing medical education. The third one is that in Millenium Project, we follow a learning outcomes-based approach and standards to deliver recognized, validated, and transferable qualifications and competencies. Now, the results of the projects will develop an e-learning environment which integrates quality standards for accessibility and use of educational content. An e-learning platform, which will offer a 3D training paths based on serious games and in-gaming methodology. An e-learning tool, which delivers Italian and European continuing medical education to specialists in the specific field of minimally invasive surgery. We also will produce some recommendations for Italian and European institutional key actors for the alignment of Italian and European continuing medical education systems. And finally, we'll produce some guidelines for the exploitation of the tested training solution and for the transferability to other sectors and context. These are the partners of the project. And now, Dr. Panagiotis Antoniou will guide you through the 3D learning environment.
Actually, what we're going to do is attempt to guide you through the process of registering yourself and trying to access the environment yourself. If all of you who have personal computers, either Mac or PC, can access from this site the platform URL, from which you can enter the environment. The first step that you will, the first screen that you will encounter is this. It's a login screen. It's a simple login screen with which you must register in. I don't know how many of you are in the medical profession here? Okay. Do all of you have personal computers with you? No tablets? Okay. Then please go ahead and try to register on this site in order to have the hands-on experience. This environment requires, as you see, it's the 3D environment here. This environment requires the Unity plugin. In order to download it, you can visit this page. It's a mirror from the Imaginary, one of the partners who has the plugin, in order to download it. Anyone who has some experience with Unity-based or browser games should have this installed, but in case that you don't have it, then you can download it from here. Now, as you feel free to ask any questions you have or something. Go ahead.
Can you flip back to the previous URL? John can't see it.
This one? Okay. The environment is a standard 3D environment realized in Unity. It's quite simple 3D. With a mouse, you can mouse look forward, backwards, and with the standard gaming interface, WASD, you can move in order to navigate the 3D environment. Now, what the actual content is all about. Upon approaching an interactable object, you will see that the necessary key will be highlighted. You can press it. Yeah. Come again? Please input placeholder with the fiscal code for VAT reasons. At the moment, place any number. It's a placeholder. You don't have to input your own. The educational experience is arranged in two sections. In one, you have the auditorium. It's on your right, this way, where you can see it has two doors. Oh, and actually, I just started Word, forgive me. Where you enter the auditorium, and you click on a teacher.
Sorry.
Go ahead.
They're registering right now, so if you could wait 2 or 3 minutes, finish the registration process.
Oh, sure, sure. Okay. Amen. Okay. What is really needed in the registration is username, password, and email. There are some fields that are denoted with asterisk, which means that they are mandatory, but you can definitely input placeholder information there. You are not obligated to input your real name or something. This is used mainly for record keeping for the final assessment that you'll have about the experience. At the moment, any one of you who is registering, please fill at least the asterisk fields and then proceed to log in. For example, fiscal code, as I saw that it had some problem, it's a placeholder. You can put any number, it won't matter. As well as country, date. Go ahead. Come again? Yeah, unfortunately. Yeah, it's about the VAT number, but you don't have to input the correct number, please, in the fiscal code. Yeah, any number will do. Just make sure that the two, this and its confirmation, are the same.
Actually, the 3D environment can be accessed by entering the full URL without registration.
Then we have a security issue as well.
Okay.
But that's a thing with demo applications. While you're registering, let me just note that the approach that is applied in this environment is one of first exposition and then exercise demonstration. As you will see after a while, in the auditorium, a series of modules exist. At the moment, there are only two, cervical dysplasia to invasive cancer, the long transformation, and the staging of gynecological carcinoma. And clicking on each one of them will open a new window when you'll have to input your name. Any name will do at the moment. This is actually where the approach that Dimitris described a little while ago is apparent. While the 3D environment is fully navigatable and accessible, the actual training material is offered through a totally web-based interface using the capacities of the M-Educator outcomes. Here, you have a simple tree structure of the training material. You can access simple videos. Μα το κάνει login. Login. Okay. Let's see. Okay, let's take it from the top. Go ahead. I'm not sure. I think that on, not on Android. I'm not sure. Actually, as my colleague informed me, when you register, there is a small self-assessment, a small assessment tool in order to identify the level of expertise for the case. Okay, then. As I understand, there's a rather long process of installing the Unity player and installing the whole prerequisites for the environment. So I'd kindly ask you to leave this process for a little while afterwards while I demonstrate the functionality. And then you can also access this environment from any computer that's browser-based, that has a browser, and can install the Unity plugin. So if I may have your attention on the screen, please. The experience consists of two parts, as I was mentioning before. One is the educational part in the auditorium, where the user can access lessons there is a introductory material where you can answer and have express your learning outcomes, what you expect to learn from here. You can just fill some things. You can read the full documentation of the projects, or you can follow to a more in-depth help screen. The whole material is accessible from the tree structure to the left. It's organized in educational parts. Taking one at random, there is a training video. I'm not sure if you have audio. That describes the material. Afterwards, there is a reflection questionnaire where the user can reflect and assess the absorption of the material that he had. You can note that when you press every response that you choose, the correct transparency is demonstrated to show you why you were wrong or right. After you finish each course, you can one moment, please. And that seems to go not quite as well. We do seem to have some problem with the environment at the moment. Okay, we can go back. As I was saying, when you finish one of the courses, which we did a little while ago, we can access the test room, which is an area of the game environment that is sealed until we have experienced the content, where there is a series of mini games that the users can play in order to assess their knowledge. Now, this one is about screening of cervical cancer. It is done in the form of correct true or false sentence game, where the user must, from these 9 sentences, choose which is correct and which is not. Now I'm just pressing at random because I'm no expert at it. After some attempts, after 3 attempts, the message of either correct or wrong answer will pop up. Well, another game is a variation of a memory, card memory game, where you have to match the cards that you need to complete the right sentences. There is a number of attempts that you have in order to complete it. Come again? Okay. Okay then. Any other correct? Yeah. I'm actually not a doctor, a medical doctor, so. But still, there are 15 attempts, so I got it right just by trial and error. Mostly error. Okay. So moving on, the user can go ahead to the auditorium again. Have a go at the second lecture, sort of speak, which is not a lecture, it's a structured learning material for self-paced learning. Where she can experience, she can see the video. Continue with reflection questionnaires. I actually got one right. And can then continue in the environment. To have unlocked, as anyone before watching this demonstration should have seen that when I tried to access this door before accessing the material, it was mentioning that it was locked. At that point, it's unlocked, and the game content can be accessed. can see, the gamification aspect of the platform awards badges for every game completed correctly. So the player, the user, is motivated to try again to achieve a better badge, a better score, so to speak. Well, in closing, I'd like to invite you all to try the experience. I know that this was quite fast and was quite difficult to follow if someone was to try and apply all these technical steps in order to experience the platform here now. But what we'd really like to have from you is your feedback about the experience, about what needs to be improved, as well as about how to better and more efficiently address the needs of this specialty. I don't know if you have something that you need to ask or discuss. Go ahead.
So I'm not quite sure why you would use a 3D environment. Sorry.
Yeah, go ahead.
There's no microphone back here. Why would you use a 3D environment for what you're teaching here? It brings to mind a much applauded Second Life demonstration, but it was by Stanford or Harvard or somebody. But they were trying to teach heart sounds, and what the learners spent most of their time doing was stumbling over the hospital bed, trying to maneuver around the room, when the educational objective was to learn heart sounds. And everybody thought, well, this is cool, they can move around, but there was no point because the heart sound recordings were not very good, and it didn't matter where you put your stethoscope on the 3D chest. It was a misapplication of the 3D environment. It was neat but irrelevant. So have you looked at that, and what's the relevance of doing this in a virtual world as opposed to doing it with a constrained pathway environment?
You are quite correct. At this moment, it's a quite small sample of educational material, and the gaming aspect, the 3D environment aspect, it's actually limiting the experience. You're correct on that. However, the main goal is to expand it and have a space like a virtual hospital, which we will have not only, for example, here we had surgical cases. The gamification aspect can move, and we hope to move beyond simple card games. It could have the immersive capacity of the 3D environment. We would hope to include virtual patient cases, branched and not just expository material along with simple games. And that, at least as we understand it, would be where the power of the 3D environment would be required. At this moment, the 3D environment is a proof of application for what can happen in this platform. It's web-based, it's 3D, it can support medical education material, and we need to expand on that. Yeah, go ahead,
So
sir.
I get that, but what I'm challenging you to do is taking it, when you go beyond proof of concept, what educational topics is this going to be an advantage for? Because at the moment I'm not seeing that. And I hate to sound terribly skeptical about it, because what you've done is lovely, it's simple, it's much easier than Second Life. But I'm still thinking that what material are you going to be presenting which is going to benefit from that? I'm not seeing
Yeah, what we're aiming to achieve is exactly at the end of the project, at the end of this endeavor, not only the project, is something like a hospital environment, an integrated hospital environment where educational material will be delivered, but also the user will have the freedom to move around and have the verisimilitude of the hospital experience. Applications of manual skills comes to mind, but that comes way afterwards, after this. At the moment, the concept of having a place, a 3D place, where you can move around and be exposed to a radiology department, to a surgery department, to some kind of emergency room, in order to get that kind of full experience, that's the first step that we're aiming at.
It would be beneficial to replicate a real hospital environment. Like, for example, I don't know which hospital is here in Thessaloniki.
Yeah.
Inside the game, like the emergency room, other rooms that are inside the hospital, so the users to have the experience before they go to the real environment. Where exactly are the medical stuff inside the room that they will use when they have patients?
Yeah, that's the idea is to familiarize the user with actual learning, with actual hospital environments.
Exactly.
Implementing a specific, for example, if this platform was to be deployed at a hospital, a specific hospital, it could facilitate the creation of a specific hospital environment.
And also you can add users, like nurses and doctors at the beginning, so you will decide what kind of scenarios will run.
Well, the overarching goal of this endeavor would be a medical MMO, massive multiplayer game where everyone has a role and can
communicate
respond
also, chatting. And
yeah, but as Professor Tops mentioned before, this could be facilitated better in platforms like Second Life, which have Second Life or OpenSim, which have seamless online capacities. However, this proves that this demonstrates that this environment is viable for educational purposes. At this moment, it's somehow hit and miss, but the principle is sound. Any other questions, please? Yeah. You'll have to either use the microphone or speak louder.
Yeah, it's not clear the architecture of a system. You mentioned before educator, the 3D environment, and the branch cases.
Yeah.
Are these three different systems? Are they integrated? Or?
The way I understand it, it's that the 3D environment is simply realized in a branching game, a 3D game, and the actual content is accessed through a classic learning management system interface. Now, the actual architecture, I can't inform you, but to give you an overview, to give you a rough sketch, it's a 3D environment that links to courses from a learning management system.